You've recently been told you need cardiac surgery. Some anxiety about this procedure is normal. This video explains what you can expect before and after surgery, so you can be as relaxed and comfortable as possible and informed about the kind of care and treatment you'll receive. It also provides information about how you and members of your family can help in your recovery.
At Bronson Hospital, we take pride in offering a comprehensive heart care program that's tailored to your individual needs. The doctors and the nursing staff are very experienced, and they're here to help you along every step of the way. We want to make sure that you understand what the problems are, what the treatment options are, and how your stay in the hospital is going to progress.
Depending on your individual situation, your surgery may be scheduled in the next day or two, or you may be discharged home and come back for your surgery. You may want to write down any thoughts you have as you watch the video, so you can ask questions later. Your cardiologist has referred you to a cardiac surgeon. You'll meet with your surgeon, and he'll explain the procedure as well as the risks and benefits of the procedure. You and your doctor will decide the best course of treatment for you. At this time, you'll be given instructions for pre-surgery testing, and your surgery date will be scheduled. Pre-surgery testing takes place in the hospital or in the pre-admission testing center. The center is located next to the main entrance on the first floor, and parking is available in the Vine Street parking ramp. You'll be given blood tests, a chest x-ray, and an EKG prior to surgery. You will also be asked about your health history, previous hospitalizations or surgeries, allergies, and medications you are currently taking. A brochure titled The Patient Path to Cardiac Surgery will be given to you prior to your surgery. It will help you know what to expect during each phase of your cardiac surgery and hospitalization. You will meet with an anesthesiologist prior to surgery to discuss your health history and medications and any previous surgeries. You will also be taught how to breathe deeply using a device called an incentive spirometer, or IS. It's important to practice with the IS because your lungs will need exercise following surgery. Coughing and breathing deeply using the IS as soon as possible after surgery is very important in speeding your recovery. Eileen Campbell is Bronson's cardiothoracic surgery liaison, and she will review some key points to remember prior to your surgery.
Some things to remember before your heart surgery would be to try to avoid any strenuous activity or emotional upsets. Your physician will ask you to stop some medications. This would be including aspirin, ibuprofen, Plavix, or some of the medications such as Celebrex. If you live alone, now would be the time to start thinking about having someone come and stay with you for 1 or 2 weeks after your heart surgery. And also, if you have any increase in your symptoms, you absolutely need to notify your cardiologist or surgeon with these problems. The night before surgery, we asked you to shower or bathe with a special solution that the hospital has given you. We also asked you to shampoo your hair and to cut and clean your fingernails. If you do wear nail polish, now is the time to remove the nail polish. The night before surgery, you can have anything you'd like to eat for dinner, but we asked you not to have anything to drink or eat after midnight. On the day of surgery, you may be instructed on medications to take and when to take these medications. We asked you to take them with just a small sip of water. If you are currently an inpatient, you will be going down to the pre-op area approximately 2 hours before your scheduled surgery. Your family is asked to come up to your inpatient room, so they may go down to the pre-op area with you. If you are being admitted the day of your surgery, you will be asked to report to the 2nd floor West Pavilion Surgery Family Waiting Room 2 hours prior to your surgery. Parking is available in the parking ramp adjacent to the hospital.
A staff member will take you to the pre-op surgical area to prepare for your surgery. Family members may accompany you if you like. You will meet with your anesthesiologist again, who will review the information you provided earlier and ask specific questions related to anesthesia. The IV is started at this time. Just prior to surgery, your family will be taken back to the inpatient surgery family waiting room. They will be told when your surgery begins and when it ends. Because the surgery will last several hours, they will be instructed to let the receptionist know where they will be if they leave the waiting room. The surgeon will meet with your family immediately after the surgery. The receptionist will provide family members with a portable paging system. The pager will light up when it's time to return to the waiting room. When it does, please see the receptionist. You may be given medication before surgery to help you relax. Then you'll be taken into the operating room. You will be asleep during your surgery. After surgery, you will be moved to the cardiac surgical unit on the second floor of the West Pavilion. Only immediate family members will be allowed to see you while you are in the CSU. Young children will not be allowed in the CSU.
Immediately after the operation, you'll be coming out of the operating room connected to a lot of different tubes. You'll have a breathing tube in place. That's generally removed within 2 to 6 hours after the surgery, once you're doing okay both from the heart and the lung standpoint. You'll have a tube in through your nose into your stomach. That's generally moved a little bit after the breathing tube is removed. You'll be connected to intravenous tubing and also have some chest tubes that drain the area around the heart where we work. The chest tubes are generally removed the following morning, which is generally the time you'll be transferred up to the medical floor. Each patient's pain is a little bit different. That'll be controlled basically by the nurses asking you about your level of pain.
Once the breathing tube is removed, a nurse will help you sit up in bed. You will walk a short distance with help 3 or 4 times a day, and will be shown how to move with minimal discomfort to your incision. A nurse will monitor your blood pressure and pulse while you walk, and you will be given pain medications for any discomfort you may feel. It is important to use the IS every hour you're awake. Coughing will help clear your lungs of excess fluids. A firm pillow over your chest will help you when you cough. Coughing, deep breathing, using the IS, and walking help prevent complications such as pneumonia and blood clots. When you are stable and ready to leave the CSU, you will be transferred to the cardiac unit on the 4th floor of the East Pavilion, where you will stay until discharged. Most of the equipment will be removed in the CSU, but nursing staff will continue to monitor your heart rhythm 24 hours a day. Please contact your nurse if you experience any pain, and pain medication will be ordered for you. The nursing and rehab staff will continue to walk with you 3 to 4 times a day, increasing the distance each time. You should continue to use the IS every hour you're awake. Extended family members and friends are allowed to see you during normal visiting hours while you're in the cardiac unit.
Before you go home, you will receive instructions from our registered dietitian. She will suggest that you not add salt to your food, avoid processed foods, and also avoid foods that are high in sodium. Eating several small meals a day, focusing on high protein foods, will help promote healing and your recovery. Before you go home, you will receive discharge instructions, including how to care for your incisions, activity restrictions, and when to call your physician. We ask you to continue to increase your activity, walking with your family or by yourself to gradually become stronger. Please do not let anyone pull on your arms when you are getting out of bed, though. You will also receive information on what medications to take, and you will also receive a prescription for pain medications. After cardiac surgery, our patients are referred to a home health care agency. Our case manager will talk to you and your family about your home care needs. She will also check with your insurance company for your coverage. The nurse will come out to your home after discharge to monitor your progress and continue your cardiac education. This and additional information is available in our Patient Path to Cardiac Surgery booklet. Please refer to it after you are discharged.
A family member will need to accompany you when you are discharged home, as you will not be allowed to drive for a few weeks while your chest continues to heal. Take the IS home with you and continue to use this device every 1 to 2 hours while awake at home for the next 3 weeks. After you are discharged home, you will be referred to a cardiac rehabilitation program that combines physical rehabilitation with lifestyle modification. It's important to remember to follow a cardiac diet low in fat and salt. If you have any questions before or after your surgery, please contact your surgeon's office or talk with your nurse or clinical liaison. Our cardiac surgery team here at Bronson is dedicated to assisting you throughout your stay and recovery. Please do not hesitate to ask questions and share any concerns you may have with any member of our team.